Okay, welcome. My name is Annie Lindy Kugel. I use she, her pronouns, and I am the Executive Director for the Community Services Network. I'm super excited to be here today to work with CareOregon to share such important information related to the health-related social needs benefit that's coming. This session will be recorded and will be saved on the CSN's YouTube channel. Go ahead. So this is a three-part series, and it's September 20th, October 11th, and October 25th. And we have only allocated 1 hour, and there's a lot of information to share. So please use the chat for any questions you might have. And if we don't answer them today, we will get to them in future webinars. And you can also register here if you are receiving this link from a colleague and you didn't register through the system. If you could register using this QR code, that would be fantastic. Then you'll get all of the follow-up information as well. Go ahead. So this benefit series is presented, like I said, by the CSN and CareOregon. Again, my name is Annie Lindy Kugel, and we have Dave Fife, the Director of Population Health from CareOregon. Sorry, I can't see you, Dave. There we go. Okay. And Ifomo Motu is the Director of Community Partnerships with CareOregon, and Stephanie Auksher with Population Health Portfolio Manager with CareOregon. Thank you all for being here. And our plan for today is to build foundational understanding of the Oregon Health Plan and Oregon's coordinated care organization structure to prepare community partners to participate in the upcoming health-related social needs benefit that will be rolling out soon. We will also be defining the housing, food, and climate benefits that will be a part of the HRSN benefits, and discuss what it means to provide housing, food, and climate support as a Medicaid benefit. For those of you who just joined us, if you could just make sure that your side is muted, that would be lovely. Thank you so much. Okay, so here we go. What is your comfort level on a scale of 1 to 5? What is your comfort level in knowing what to say if someone walks into your door of your nonprofit or agency and asks, I heard that I qualify for housing support through OHP. Can you help? On a scale of 1 to 5, 5 being yes, you can help, 1 being no, you don't think you could help, please put in the chat what level your comfort is currently. Great. Awesome. So I see a lot of 2s, 3.5, some 4s, 2s, 1s. This is great. This is great. Some 5s. Awesome. Great. So we have a lot of content to share with you, and we hope that towards the end of this presentation and the webinar series that your numbers will be more in the 4 or 5 range. That's our goal. Awesome. Thank you. Okay. I think it's either Dave or Stephanie, take it from here. Thank you so much.
Thanks, Annie, and thanks everybody for sharing that information. I think we have this great opportunity with this health-related social needs benefit to strengthen relationships between healthcare and community supports. And so what I'm going to do along that line is share just a little bit of information about Medicaid, about coordinated care organizations. And so that you can kind of understand who is this new partner and where do they come from. I think that's really an important first step in connecting and really developing good relationships over time. So first off, what is Medicaid? You probably have heard about this in the news. You know that Medicaid is a public health insurance program. But let me tell you just a little bit about what Medicaid does and where it comes from. So it's a partnership between the state and federal government, and eligibility is determined for Oregonians based off of their income, and in some cases based off of other circumstances they might have, like blindness or a disability. It's called an entitlement program, which means that if someone meets the qualifications, they can enroll. It's not limited in any way. And it's free for those who qualify. So what that means is that folks on the Oregon Health Plan don't pay premiums for their health insurance. They don't have deductibles that they need to meet. And it is offered in Oregon regardless of immigration status through the Healthier Oregon initiative. So let's talk a little bit about what those income requirements are, because I think that's really interesting way to think through how many folks might qualify for the Oregon Health Plan. So the requirements are different depending on where someone is in the stage of their life. And you can see that children aged 0 to 18 years are qualified up to 300% of the federal poverty level, so the FPL. You need to be an Oregon resident in addition to meeting that income eligibility. And like I mentioned, this is regardless of immigration status. So as long as you meet those criteria, you can get health coverage through the Oregon Health Plan. So let's look at what that actually means in terms of numbers right now, knowing that these things change over time, so don't hold me to this math forever. But that means that a single adult earning less than about $1,600 a month qualifies for the Oregon Health Plan, all the way up to children in a 4-person household that earns less than about $7,600 per month, likely qualifying for the Oregon Health Plan. So I want to see, let's see how your math is doing and your understanding so far. I got a couple quiz questions for you. So let's say that we have a single man living in Portland and his job pays him about $1,500 per month. He's not a U.S. citizen. Anyone in the chat can throw this out there. Does this individual qualify for the Oregon Health Plan? He has a job, $1,500 per month, not a U.S. citizen. The yeses have it exactly right. All right, here's a trickier one for those of you that want another challenge. So Maria and Jeff are married and have 2 children. Their kids are named Jamie and Joe, and they're 10 and 6. Now, both of their parents are employed, and together they make about $6,000 per month. Does anyone in their family qualify for the Oregon Health Plan? Again, hit me up in the chat. What do y'all think? Oh, good. I stumped a few people. This is good. This is what I was going for. Yeah. So in that case, it's possible that Maria and Jeff, the parents, might not qualify for the Oregon Health Plan, but their children still might. And that's because that income level is a little bit more generous in terms of benefit eligibility for children than it is for adults. And in fact, as we go to the next slide, you'll see that eligibility ends up being reflected in Oregon Health Plan membership. And these are numbers from across the state. So of the 4.2 million or so individuals who are Oregonians, about 1.5 million as of August are in the Medicaid program, are members of the Oregon Health Plan. And you can see that a lot of those people are children aged 0 to 18. Medicaid and the Children's Health Insurance Program has a lot of kids that we take care of. But you can see it's not just that. There's adults that are 65 and older who qualify for Medicaid and may also qualify for Medicare. And we're using multiple government programs there. But you can also see that 42% of births, give or take, in Medicaid are in Oregon are funded by Medicaid. So that those first moments in life and pregnancy is something that Oregon Health Plan has a lot of experience focusing on and supporting. And you can see that there are Medicaid members from the least to the most populated counties in Oregon, and about a third of folks in any given county in Oregon are Oregon Health Plan members. So this is touching many of us. Many of our friends, our neighbors, are members of the Oregon Health Plan. So what does that mean when you qualify for the Oregon Health Plan? So you get coverage as a member to a set of benefits. And those benefits are a defined set of items or services that a health plan will pay for. And lots of times you will think about, oh, there's physical health benefits like going to the doctor or getting a lab test or going to the hospital. But the Oregon Health Plan also covers benefits related to your behavioral health, like counseling and therapy, or oral health, like getting support from your dentist, getting a filling. It's meant to be a holistic set of benefits, and that even extends beyond these 3 to additional benefits for our members. including support for language access as someone seeks care, for health-related services that might be supporting social needs, to care coordination and even non-emergency medical transport. Now, all of these benefits are coordinated in Oregon by a set of organizations that are called Coordinated Care Organizations, or CCOs. And this is an Oregon-specific approach to managing Medicaid. So CCOs are held accountable by the state for the health outcomes of their members. So they're required to provide strong coordination, they're required to integrate services, and they focus a lot of time and energy on preventing unnecessary disease and managing and helping people manage chronic conditions that they already have, and ensuring that somebody is getting person-centered care as they maybe require multiple doctors or multiple places to really achieve their health goals. Those coordinated care organizations are funded by Medicaid dollars. And those dollars come both from the federal government and the state government. And when there is money involved, there are also requirements. So the federal government's role is setting minimum standards for individuals who qualify for Medicaid and minimum expectations for the services that will be covered by Medicaid. And they contribute a lot of funding to meet those minimum requirements. But the state government is also involved. They can choose to expand who qualifies, and Oregon does that often. They can decide on expanded criteria and make decisions about additional services that should be covered by the Medicaid plan. And ultimately, they're making decisions around the state budget and the state plan. So both governments are collaborating and funding this really important benefit that many Oregonians access. So putting it all together then, you got the federal government, the state government, these coordinated care organizations. What is their relationship? Well, you can see in our triangle diagram here that the federal government is represented by something called the Centers for Medicare and Medicaid Services, or CMS for short. And that's the federal agency that manages the Medicaid program across the nation. And the Oregon Health Authority, or OHA, is the Oregon entity in the state government that manages the Medicaid program in Oregon. They are the organizers and administrators of the Oregon Health Plan for the entire state. But those coordinated care organizations work closely with the Oregon Health Authority. And this is where many Oregonians who receive Medicaid are supported as their health plan. And that health plan then works with the many partners across the state and in communities like primary care providers who are then providing direct care. So the funding and support and coordination moves all the way down that triangle to providers who, like you, soon to be, who are providing important services that support the health of Oregon Health Plan members. Now that is the simple version. And real briefly, I do want to indicate a couple things that sometimes it gets a little bit more complicated than this. So if you're coming and joining us from the Portland metro area, there's a coordinated care organization there called HealthShare of Oregon that has multiple partners. And so you might think, I know what CareOregon is, but I'm not sure what HealthShare is, or vice versa. And HealthShare is supported by many different organizations in the Portland metro area. There are also other entities that support tribal health and other approaches to health within the Medicaid structure. So it varies depending on some context sometimes, but you can see that the basic structure continues for all areas in Oregon. Now, as we go ahead, it's important to kind of indicate that there are different coordinated care organizations throughout the state. So if you squint really hard at this slide, you can kind of see that there are different organizations supporting the health of Oregon Health Plan members across the state. So as an example, one last quiz question before I wrap up my portion. Let's say that you live in Lynn County and you qualify for the Oregon Health Plan. Which coordinated care organization, based off of this map, is going to be supporting you and coordinating your care? Any takers in the chat? All right, Deanna with the win. That's great. All right, Intercommunity Health Network would be supporting that CCO in Lynn County. And that'll be different as someone lives in different counties in the state. And the role of a coordinated care organization has developed over time and to increasingly support the elements related to the social determinants of our members' health and equity. And so briefly, coordinated care organizations have been connecting dots for holistic care for multiple years. And they have been using something called health-related service flex funds for many years to support health-related social needs. Investments continue to flow into communities through programs like Community Benefit Initiative grants and the Supporting Health for All Through Reinvestment Initiative. In just this year, all Oregonians began to qualify for full OHP benefits regardless of immigration status. So over the time, in just a few years, coordinated care organizations have been developed and started, and they have increasingly developed a set of programs to support community needs, community health, and the health-related social needs of our members. And starting in 2024, as you may have heard because you are here, that track record of support for social determinants of health is going to take one step further into a guaranteed benefit for some of our members on the Oregon Health Plan. And Oregon is really just one of a handful of states that is trying to do this with the recognition of its importance. So that's a little bit about the Oregon Health Plan, what Medicaid is, how coordinated care organizations fit in, and why they're so worried or interested in the social needs of our members. So any questions that we can answer around any of those topics before we jump into the benefit itself?
Dave, there was a question in the chat related to are these numbers accurate if SSI and SSDI is the income source? Those are related to qualifying income range.
That's great, April. I'll have to follow up with you. Understand the question, but I'll have to follow up to confirm that for sure. So thanks for asking that question.
Awesome. And then the second one from Melinda, are SNAP benefits considered part of the household income?
Thanks for that question, Melinda. I'll have to do the same and follow up with the answer.
And then the next one from Melinda, what healthcare options are there for 65 plus who have a household income that is just below 138% of the federal poverty guidelines and has Medicare insurance coverage, but have high deductibles and or copays? As I understand it, they are not eligible for OHP Medicaid because they are over 65.
Great, thanks, Melinda, for that question. So while I'm not an expert in determining the eligibility, the situation that you described here sounds like somebody is qualified for both Medicaid and Medicare. And there are special plans called dual special needs plans for folks that qualify for both of those healthcare programs. And what that means in practice is that those same benefits that come from a Medicaid health plan, like no cost to the member, support for those things like oral health or non-emergency medical transport, are connected to the broader set of benefits that are available through a Medicare plan. So in fact, many people, many thousands of Oregonians qualify for both Medicaid and Medicare and are served by those dual special needs plans.
Awesome. Thanks, Dave. Let's see. Barbara would like to know if Barbara could have a copy of the slideshow, the slide deck. I don't know if there's a plan to share that or not.
I think we'll have that. Did you mention? I think we'll have it on YouTube as where we'll have the slides.
The recording will be for sure. And then when counting income, does your child's Social Security survivor's benefit count towards their income?
Well, these are great questions on the nuances of eligibility. And since I'm not an expert, thanks for all of them. We'll get you these answers.
Perfect. Great. And that's all that I see. Thank you.
Great. Thanks for those questions. Good morning, everyone. My name is Stephanie Ochter. I use she, her pronouns. I'm on the population health team at CareOregon, and I am going to bring us through our next topic, which is the health-related social needs benefit. So before we dive into the benefit, we wanted to start by talking about what is something you might have heard about a lot recently, which is the 1115 demonstration waiver. So this is its formal name, 1115 demonstration waiver, but you might have heard it referred to as a shortened version of this, such as the 1115 waiver, maybe just the waiver. All these terms really mean the same thing. And what they refer to is this process and this opportunity for the state to negotiate changes to our Medicaid agreement with the federal government. So when we need to update our Medicaid agreement with the federal government, we can go to the federal government and ask for them to waive some of our contract terms or add new terms. And this waiver process offers us a chance to test new approaches to providing Medicaid benefits that will improve the care for our Medicaid members, increase the efficiency of providing Medicaid services, and reduce the overall cost of administering Medicaid. So essentially, this concept, the 1115 demonstration waiver, is our opportunity to test something new and demonstrate or show to the federal government that we have a new way of providing Medicaid benefits that provides better, more cost-effective care. So waiver projects are approved for 5 years, but then can be extended beyond that. So every state has an opportunity to participate in this process, the 1115 waiver process, but not every state does. Oregon has been participating since 1994, and our first waiver was actually what established the Oregon Health Plan. Throughout the kind of history of Oregon participating in this waiver process, it's really helped bring a lot of new innovation to our state's Medicaid health plan. The coordinated care organization model that Dave talked about earlier came through the waiver process back in 2012. And our most recent waiver was approved last year in 2022 and will help us to continue innovating and providing better, more cost-effective care to our members. So let's take a closer look at our most recent waiver. Again, this was approved last year. It started in October of 2022 and runs through September of 2027. The goal of Oregon's most recent waiver was to advance health equity, and the changes that we proposed to the federal government, we as a state proposed to the federal government, were informed by a public input process with a lot of different community engagement sessions, opportunity for written feedback. All of this was led by the OHA. And perhaps some of you in this space today were part of that process. Oftentimes, you might hear this term, the waiver, and the health-related social needs benefit or HRSN benefit kind of used interchangeably. But the waiver actually includes a couple of really important changes in addition to that benefit. So one of the things that the waiver, our most recent waiver, does is extends OHP membership to 2 years. So previously, when you applied to be an OHP member, you were approved for 1 year. And now that has been extended to a 2-year approval, which will really help with preventing people from losing coverage. The waiver also guarantees coverage for preventive health services for ages 0 to 21 years old. And then it introduces a health-related social needs benefit starting in 2024. So some of these changes have already happened, some will happen in the coming years, but when they do go live, the waiver applies to all OHP members across the state. So everyone who's enrolled in OHP will be able to benefit from these changes, and all coordinated care organizations will participate. There's not an option to opt out of any of these changes. So we are going to focus in now on one of these changes that was approved through the 1115 waiver, which is the introduction of a health-related social needs benefit, often abbreviated HRSN, that will be starting next year. Before we do that, though, we wanted to ground ourselves in some definitions. We know that health-related social needs, or HRSN, might be a new concept or a new term for you, but social determinants of health, I think, is often used a lot more frequently. Many of you might be already familiar with the social determinants of health framework and providing services within that framework to really support some of these social determinants. So social determinants of health, sometimes just called social determinants or SDOH, are the conditions in which people are born, grow, work, live, and age that are shaped by the distribution of power, money, and resources. So we can really think of social determinants of health as those conditions at the systems level or policy level that impact our health. That could include things like economic stability, social and community context, or neighborhood and built environment. When we talk about health-related social needs, or HRSN, sometimes also just called social needs, a couple of different terms really referring to the same thing. What we're talking about are those unmet social and economic needs that individuals experience that contribute to poor health and well-being. So with social determinants of health, we're talking about some of those systems level conditions. And when we're talking about health-related social needs, we're really talking about that individual level impact and that individual experience. Some examples of health-related social needs are food security, stable housing, income and employment, interpersonal violence. Many of these things can be a result of an individual's community's SDOH. So if we think about the built environment in a neighborhood and lack of affordable housing, that's something we would consider a social determinant of health. But then at that individual level, that might translate into homelessness or housing instability. Research shows that health-related social needs can account for as much as 50% of health outcomes, which is actually much more than clinical care. So what that means in practice is that if we have an individual who is experiencing homelessness and hunger, those things are going to impact their health a lot more than clinical care. So addressing their homelessness, providing housing support, income, rent assistance, housing navigation support, for example, and addressing their hunger through things like meals or food boxes, that's going to have a much bigger impact on their health outcomes than if they were to only just go to a doctor. So the health-related social needs benefit is going to focus on 3 specific social needs. That includes housing, food, and the impact of climate on health. The overall goal of the benefit is to provide these supports to OHP members who are experiencing certain life transitions, which we'll talk about in a minute. And the goal is to improve their health during and after these transitions. So Dave shared earlier that when we talk about a benefit, what we're talking about is a specific service or item that is covered through the health plan. So we'll take a closer look at what it means to provide housing, food, and climate benefits. So when we're talking about climate supports, what we're talking about is medically necessary devices that help mitigate some of the impacts of climate on health. That includes things like air conditioners and heaters that help maintain healthy air temperature, air filtration devices that help maintain healthy air quality, personal power supplies that can help with powering medically necessary devices like ventilators in the case of a power outage, and refrigerators that can help with storing medically necessary medications. In terms of housing supports, we also have a list of defined housing support that will be provided. So that includes rent or temporary housing assistance for up to 6 months, utility assistance for up to 6 months, pre-tenancy and tenancy sustaining services. So we can think about a lot of like eviction prevention would fit into this category, or helping people prepare to be housed, especially if they're transitioning out of homelessness. Housing navigation support, which is really focused on helping individuals find housing. One-time transition and moving costs, which could include things like a moving truck or furniture for someone moving into a new place. Housing deposits, including first month's rent, security deposits, and then medically necessary home accessibility modifications, which could include things like ramps or grab bars in the home. And then with food benefits, this will include nutrition counseling and education. So one-on-one counseling, group classes, medically tailored meals for up to 6 months, meals for up to 6 months, or pantry stocking, and then fruit and vegetable prescriptions for up to 6 months. So the benefit will also come with eligibility criteria. So when we think about the goal of the benefit is to support individuals experiencing significant life transitions. This is where we then think about who is eligible. So that first stage of eligibility, there's a couple of different layers of eligibility that are required for someone to access this support. And that first layer is that someone's a current OHP member. So again, this is a benefit being offered through the Oregon Health Plan. So someone needs to be a current member to qualify. Second, individuals who are OHP members also need to be experiencing one of the qualifying significant life transitions. So that includes any of the following: youth involved with the child welfare system, including youth leaving foster care, people experiencing homelessness or at risk of homelessness, people released from jails, prisons, residential facilities, and the Oregon State Hospital, people transitioning from Medicaid only to one of those Medicaid and Medicare plans that Dave was talking about earlier, so to dual coverage, youth ages 19 to 26 with special health care needs, and people living in an area experiencing an extreme weather event. For many of these, the criteria will be a little more defined, but give kind of a period of time that you've experienced one of these transitions within, such as you've experienced this transition in the last 12 months. In addition to that, we will need to confirm that an individual has a social health need. So they have a food, housing, or climate-related need that kind of justifies their need of the support. And then because this benefit is really focused on that health-related social need, there also is criteria for eligibility around having a clinical health need. So examples of what would qualify as a clinical health need is a complex physical health condition, such as an autoimmune condition or a chronic cardiovascular condition, mental health conditions such as depression, bipolar disorder, pregnancy, age will also be a qualifying factor. So individuals who are under 5 years old or over 65 years old. This isn't a complete list of the clinical health needs someone would need to qualify. This is just some examples. There will be a specific clinical health criteria that will be approved when the benefit goes live. And then there's a few of the benefits you might have noticed on our last slide that do have additional eligibility criteria. They will be offered to a more focused population, just like a few of these transition populations, for example. Okay, so with all of that eligibility criteria, how will we know that someone is eligible? So this is a sample workflow of how someone might, their eligibility would be determined. So first, an individual who might qualify would participate in a screening to determine their eligibility. That initial level of screening would really look at those first three criteria that we just talked about. So is that individual a current OHP member? Have they experienced one of the qualifying life transitions? And do they have a social health need? Do they have a housing, food, or climate need? The goal of that first level of screening, or the hope for that first level of screening, is that that can take place at a lot of different locations. That could take place at a CCO could do that screening, a primary care provider could do that screening, a community-based organization or a social service provider, nonprofit in the community could do that screening. The goal is to provide a lot of access to that initial screening so that we can better connect individuals who qualify. Once that eligibility is confirmed, that information would be shared with the individual's CCO, and the CCO would be responsible for confirming that clinical health need. They might be able to do that based on some of the data they already have access to, so things like medical claims data, diagnoses on file, or they might do that by connecting to the individual and confirming that they have that need. Once that is done and the CCO is able to confirm that the individual has a clinical need and meets all of the criteria, they've confirmed that they are their member, that service would be approved. So once the service is approved, we'll provide these services. So each CCO will be responsible for developing a network of HRSN service providers. So this is kind of similar to how each CCO already has a clinical network of providers, which includes primary care providers, behavioral health providers, hospitals, specialty care clinics. Similarly, for the HRSN benefit, each CCO will develop a network of providers. Many of you might be interested in this. This will largely look like social service providers or community-based organizations really serving this role. We're going to spend a lot more of our time in our next webinar in the series talking more specifically about this criteria. We wanted to preview a little bit of it today, just kind of to give you an idea of some of the things that will be required, such as having strong community relationships, being able to invoice for services provided, being able to receive referrals for services. But we'll do a deeper dive into this in the next webinar. And we'll also talk about if being an HRSN service provider isn't the right fit for your organization, what other roles you might be able to take on to help support access to this benefit, such as completing initial screening, or even just informing the community about the benefit and helping individuals navigate if they are eligible or not. So we recognize that many of the services that we just talked about are already available in the community, but as we transition and this benefit goes live, providing these services as a benefit unfortunately isn't as simple as just providing funding for services that are already happening. Because it's a Medicaid benefit, a lot of different Medicaid rules and regulations will apply as this goes live. So that will include a few examples are potentially an additional level of documentation beyond what your organization is already collecting to help meet some of those federal and state government requirements. We'll also need to have ways to assess who qualifies for OHP to pay for these services to meet some of that eligibility criteria we just talked about. And then all the CCOs will have requirements around ensuring that members who do qualify have access to these services. Another thing that we need to consider is that through this waiver process and approval, the HRSN benefit is designed to add on to or supplement existing services in the community. So we're not able to just kind of replace services or replace current funding streams, but the goal is to add additional access to these services in the community. And again, we'll talk a little bit more about this in our next webinar when we talk a little bit more about expectations for service providers. So let's bring all of this together and talk about what it could look like in practice. So this is Julia. She is 19 years old and has recently transitioned out of foster care to live independently. That transition happened last month, and she has been diagnosed with major depression. So Julia attends an appointment with her primary care provider, and while she's there, she completes some paperwork, which includes a social health screening. And on that screening, she identifies that she has a food need. Once that happens, her doctor's office can then provide an HRSN eligibility screening to confirm that she qualifies for HRSN benefits. That might happen at the same time as a social health screening, or it could be a follow-up screening. The doctor's office confirms that she's eligible for HRSN services. She is an OHP member. She's experiencing one of the life transitions, which is transitioning out of foster care. And she indicated that she is experiencing food insecurity, so she has that social health need. The doctor's office would then send the screening form to Julia's CCO. Her CCO could confirm that she's a member and then that she also has one of those clinical health needs that qualifies for support. So again, she has depression. The CCO has information about that because she has been treated for it. So at that point, the CCO could approve Julia's request for support. She meets all the eligibility criteria, and a care coordinator at the CCO would contact Julia to establish a care plan. Between that care coordinator and Julia, they've agreed that the next steps would be to contact a local organization that's part of the CCO's HRSN provider network that provides meals and nutrition classes. Julia would get referred into those services, and the organization would follow up to make sure Julia's needs are met. This is just one way that this might happen. There might be a lot of different entry points. The journey through this benefit might look a little bit different depending on where someone's receiving services and initially getting connected. But in general, this is one option of what it might look like in practice. So some of what I just described might sound familiar to some of you if you are familiar with health-related services flex funding. So you might have attended a previous webinar series through CSN on health-related services flex, or might have been helped someone that you've worked with get connected to it. But health-related services flex funding is another source of funding that comes through the CCOs. You might have heard it abbreviated with this acronym HRSF, maybe flex funding or just flex. It has a lot of different shortened versions of the name, but it has been used in the past to connect individuals and OHP members to things that are included in the HRSN benefits, such as air conditioners, motel vouchers, utility assistance. So there are some similarities, but there are also some pretty significant differences between flex funding and the upcoming benefit. So the goal of flex funding is to provide items or services that will improve health outcomes and are not already covered under the health plan, whereas the health-related social needs benefit does have a really specific list of items and services that will be offered. Flex funding eligibility is determined at the individual level and requires a connection to a clinical care plan, whereas the health-related social needs benefit has really specific defined eligibility criteria that's based on a qualifying life transition, social health need, and clinical need. HRSF, health-related services flex funding, is accessed through a request process. And because of that request process, access to support isn't guaranteed. Each application is reviewed for alignment with requirements and then approved or denied. With the HRSN benefit, because it is a benefit, that eligibility screening will take place, and then anyone who qualifies will be able to access services. So this is our draft timeline for how the benefits will be implemented and rolled out. So one important thing to note is that these benefits will start to go live next year, but will be rolled out slowly over the next couple of years. So the climate benefit will launch first next year, January 1st of 2024 for all eligible populations. And the food benefit will roll out 1 year later on January 1st of 2025, again, for all populations, all individuals who are eligible for the HRSN benefit. Because offering housing as a benefit is a lot more complicated, the housing benefit will start rolling out a bit more slowly. So right now, our draft timeline has the housing benefit launching November 1st of 2024 for individuals who are at risk of becoming homeless, and then rolling out kind of slowly across all of the eligible populations over the coming years. So again, this is just our draft timeline. Oregon still needs approval from the federal government for this timeline, so that we might see some changes during that review process. And in addition to the timeline, we actually, as a state, still need approval for many of the things we just talked about before they're final. So if you think back to the beginning of the webinar, Dave shared about how Medicaid is managed through a partnership between state governments and the federal government. And that also applies to developing the health-related social needs benefit. So a lot of what we've shared today has been submitted to the federal government through the Oregon Health Authority has drafted plans and protocols, guidance documents. All of that has been submitted to the federal government through CMS to review. And during that review process, things might change. There might be some edits to the plan. All that will get us to a final plan, protocols, and then from there we can start implementation planning, making some more concrete changes before the benefit launches. So when you look at this process, you can see we're still pretty early on. We have a few more steps to complete before we get to launching the benefit. But part of the reason we're hosting this webinar series now is to start this conversation because we want you all to be informed about the process and what's coming so that you can also be informed partners when we get to implementation planning. All right, so we've talked through the basics of the benefit, and we have a little over 10 minutes left to answer questions that you all have. So we will open it up, and Annie, I will pass it back to you.
Great. Thank you so much, Stephanie. Lots of questions in the chat. I'm just trying to figure out which ones Dave has so kindly answered for us and which ones are still open. Let's see here. Okay, I think some of these. Okay. When you say one time, does that, let's see, does that mean that the fund will only cover move-in costs once?
Great question, and a question that I didn't realize there was a reply function on before I answered it. So it's later, further on in the chat. But the way that we think about this is, you know, someone qualifies for eligibility for a 12-month period. So within that 12-month period, it would be a one-time support for move-in costs.
Great. Okay, I see that. Sorry about that. That one you answered. That one you answered. Awesome. Okay.
There's looks like there's one I didn't get a chance to answer. A lot of questions about stability and sustainability plans.
Mhm.
And so what's unique about this benefit is if somebody qualifies, there is not an additional requirement for a stability or a sustainability plan. I can't speak to other programs that I don't manage, so I wish that I had more information there for some of the follow-ups on specific programs. But I will also say that with the beauty of this benefit is that it's designed to be immediately accessible and sufficient so that a longer term plan has a little bit of that breathing room to develop, to access other existing government programs, funding sources, et cetera. So some of the questions in the chat were around who is it starting with, who are the populations that will be receiving those housing benefits to start. And that's also one of the reasons why the federal government has, at least with our working definitions, asked us to begin focusing on eviction prevention. So we're reducing that stress on the systems that are serving the houseless populations. There are those benefits and programs that exist outside of healthcare. So we're finding an entry point that helps us to start build relationships and prevent that and reduce some of the stress that continues on those systems supporting housing.
Awesome. Thanks, Dave, so much. Any other questions that any of you have that I think we've pretty much, or Dave has answered all the questions in the chat. Are there any that are lingering? I know it's a lot of information all at once, and through the 3-part series, we will definitely break this down even more. Okay, so Deanna says that, so this is essentially in the first stage is eviction prevention.
Correct, exactly. With all the caveats that Stephanie mentioned to say it, some of these things are still getting finalized, but that's our working definition for now. And we appreciate your patience as we try to give you the best information we have. And that's also a really good reason why we want you to come to the second webinar, is as we get more final definitions and are ready to answer with greater definitiveness some of these great questions and how we're going to work together to support these members. We'll get into those details as soon as we have them.
Awesome, thank you. And Stephanie, would you mind just sharing that one screen again? I think that timeline is really powerful. Yeah, and I think that kind of the rollout, it's definitely a process and not something that everything will roll out all at once. And I think that timeline is, I know when I was digesting it, this was really helpful. Any other questions that anyone has? And again, I'll be saving these questions and we'll integrate them into the future webinars. Has the 2-year enrollment instead of 1 year already started?
So you may have heard in the news that there's a term called redetermination, which is after the COVID emergency. The state is required, again, by the federal government to check on everyone's eligibility. So as that eligibility is redetermined, that 2-year window has begun. Yes, and that redetermination process is still an ongoing process for Oregon, and will continue for the next little bit as well.
Great, thank you. And then there was another question about if the slide deck. So we definitely will be recording, but they're wondering if the slide decks will be available.
Yeah, we'd be happy to share the slide deck. I think we have the distribution list for folks who have signed up. So we will use that list to both answer any questions we couldn't get to in the chat and share some of these resources.
Awesome. Any other questions I missed? I don't think so. Okay, so at this point, if you have just a moment or two, I think it's maybe a 4-question survey. If you could just take a few moments to fill out that survey, that way we can take in any lingering questions that you might have, kind of get an idea of how the presentation went for you as far as digesting the information, and see what we need to address the next 2 presentations. And again, that just should take a few seconds to fill out. And Ruth, thank you so much for posting that. Appreciate it. Any other questions before we turn off the recording and wrap up today? Stephanie, would you mind posting the first slide just to show the dates again? Thank you so much. Awesome. Great. So this next one will be October 11th, same time. And again, we will take any questions that you have either now or I'll follow up with an email that come to you later. Please feel free to share them and we'll address them in the next 2 webinars. Thank you so much for your time. Thank you both to Dave and Stephanie for this awesome information and this resource for community. Appreciate you and CareOregon and all of the work that all of you do in community. Thank you again. Have a great day.